Good morning, I'm Father Vermisni. Today I'm going to perform hot and cold compress. So the first thing I will do, I will check the doctor's order and check for location, duration, and temperature, especially for hot compress. And next I'm going to check the patient's chart for immobility. And I am also going to prepare all the equipments and bring it to the bedside table of the patient. So here are the materials needed in doing hot and cold compress. Hot compress bag, cold compress bag, washcloth, waterproof pad, and in performing hand hygiene, I have here with me alcohol and gloves. And in checking the vital signs of the patient, I also have here with me sphygmomanometer, stethoscope, and thermometer. And today I'm going to perform hand hygiene. After performing hand hygiene and using of gloves, I'm going to identify the patient, explain the procedure, and close the curtains for privacy. Good morning, sir. Father Vermisni, your student nurse for today. May I check your wristband? Can you state your name, sir? Can you state your date of birth? Thank you, sir. So, sir, today I'm going to perform hot compress and cold compress. So the purpose of cold compress is to promote blood flow, reduce joint stiffness, and promote comfort. And in performing cold compress, the purpose of cold compressor is to lessen the inflammation and also promote comfort. And next, I am going to close the curtains and provide privacy. Now that the curtains are closed, I am now going to proceed with the procedure. So, sir, I'm going to check your vital signs. So, I will be doing the vital signs because our patient is really in good condition and not in and don't need hot compress in real life. So, I won't be able to compare the result of vital signs from before the procedure and after the procedure. So after, I am going to check the patient for pain scale and compare it after the procedure. So next, I am going to show only the part where I need to put hot or cold compress. And after showing the part of where I need to put hot and cold compress, I am going to check if there are any lesions, check for like wounds, and document the data. And after checking for any abnormalities, I am going to put waterproof pad under the area. Sir, can you raise your feet? After putting the waterproof pad, I am going to prepare the hot compress bag. So in preparing the hot compress bag, I already put hot water in it, 40 to 46 degrees Celsius, and I also consider the patient if the temperature is okay for him. And alternatively, if we're going to use cold compress, I already put ice half full in it, and I already checked if it's very close and check for leakage. So in putting hot compress bag, before applying it to the patient, I need to put washcloth over it before applying. So, sir, I'm now going to apply the hot compress bag. So, in applying, we have to put the seal upwards so that it won't spill. So leave the hot compress bag according to the duration from the doctor's order. And after, I am going to remove it. Sir, I'm going to remove the hot compress bag. And after removing, I'm going to do vital signs and check for the pain scale. And I'm going to remove the waterproof pad, remove my gloves, perform hand hygiene, and document. Alternatively, if the doctor's order is cold compress, just the same procedure. I already put the ice in it. Before applying the cold compress bag, I need to cover it with washcloth. So the purpose of washcloth is that when ice melts, it can absorb the moist and it won't spill on the patient. So, sir, I'm going to apply the cold compress bag. So that it won't hook, I can put tape into it and leave the cold compress bag for the duration according to the doctor's order. And after the duration, I can now remove it. So, sir, I'm now going to remove the cold compress and check the vital signs of the patient. Check for the pain scale. Ask the patient if the pain lessened, and if the patient said yes, we have to document that. If the patient said no, we also have to document that. So after, I'm going to remove the waterproof pad under the patient and tell the patient that I am going to remove it. Sir, I'm now going to remove the waterproof pad. And cover the patient. And after the procedure, I am going to remove my gloves, perform hand hygiene, and document and report.